his neck doesn't feel great after this accident. I would say the neck is probably the worst. Okay, folks, Dr. David Kulla here with Synergy Wellness. We're going to treat a patient here that's been in a car accident. Al, also known as Al Butter, because he's smooth like butter. Wasn't that your nickname when you were younger?
Yeah.
I've known Al for a long time now. He's been a patient. Well, I've been doing this for a long time. 22 years I've been in the field. I've known you for at least 15, 20 years, right?
Wow.
Maybe?
Yeah, long time. Long time.
Yeah, so he used to, when he first came in, he said, just refer to me as Al Butter, because I'm smooth like, no, he didn't really say that, but.
It's because I got a butter face.
So with a car accident case, it's really important in the beginning to put ice on it, but then after 3 days, you really want to use heat. Heat's going to bring more blood flow to the area and promote healing. This side down, so the right side up. And also, if you see a chiropractor after an accident, you want him to adjust your neck gently. I'm saying that softly because you've had a whiplash injury. So the first week after an accident, you really want them to be gentle. 2 weeks even. It just depends on how bad the injury was, how bad the accident was. He didn't see me for weeks after. So a lot of that initial inflammation had calmed down. So that's something you just want to be careful with. Let them ease into the care or wait a week or two after the accident to go to a chiropractor. If you're in a lot of pain, don't wait. Go right away. Okay, take a deep breath in and blow out. And the other side up. So luckily he does not have any pain shooting down the legs or numbness or tingling in the legs or in the arms, hands, or fingers, because that would signify a neurological issue or a neurological problem, which is a whole other big issue that we don't want to see him with as a result of this accident. Go ahead, lay on your stomach. So this technique is really for disc herniations, pain shooting down your leg, but I just said he doesn't have that. So why am I doing this? Well, I'm doing this because we don't have an MRI yet of his back. And also, I did this on him on our last visit, and he says he feels a lot better. So we're going to continue to do what's working for him. This is a really light force adjustment for the lower back. You just saw me adjust him before, and that's, I wouldn't say violent, but it's more invasive, right? The adjustment. He bends his knee, and I have to kind of twist his hip, and so there's more shearing force in there. If he was a patient that had pain down his legs, I probably wouldn't do that right away after an accident because I'm worried about that shearing force. Because he has pain down his legs, I'm thinking he has a disc herniation. We don't want to do too much of that shearing force. This technique is called Cox flexion distraction technique. It's much more effective and safer. And it's also effective to do on patients without disc herniations. So it's a win-win for him. And we already know that it's helped him a lot. And I can also, look, watch this table. Watch how it goes out this way. See that? So I can traction him out and do flexion distraction at the same time, which is what we're gonna do right here. And if you've never had this technique done, oh, it feels great. It's hard. How would you explain it, Al?
Prior to getting it done, it just feels like there's a lot of tension. I have a limited range of motion. But even now, certainly after the technique, but even now what you're doing, it just feels like there's a weight being lifted off my lower back, and it feels like there's more space and I can breathe a little bit easier.
Okay.
So it just feels good.
Less pressure off of your back?
Yeah, it's a lot less pressure.
Yeah. So a lot of people sit all day, and this is a great technique for those of you that have back pain and sit all day. This not only decompresses the discs, but it pumps fluid a little bit into the back of the discs and builds up the back of the disc. And most of us, our discs look like wedges, kind of like this. Facet syndrome here, this cheese wedge of disc. And this helps to pump fluid into the back of the disc and build up the space there. And not only decompress the disc, but the nerves in the back too. And you can see here, this is a really gentle motion, no shearing of the lower back. And I tend to use this technique more with disc herniations, spinal stenosis, disc bulges, people with sciatica, or definitely post-surgical cases. Post-surgical cases, you just don't want to put them on their side and adjust them. If you can avoid that, you want to do that at all costs. And this technique, flexion distraction technique, helps me avoid doing that, especially on post-surgical patients. Now, Al here is a personal trainer. for OrangeTheory. Not a personal trainer anymore, right?
He's a coach now.
He's a coach, okay. One of the head coaches there over at OrangeTheory in West Village in Manhattan, and he needs to be in shape. He needs to be able to show people what to do and not think about pain. Okay, Al, turn over on your back and slide down a little bit. Good. We're gonna do 2 spots here. Tuck your chin. Okay. Now, when I first started seeing him, he worked at ABC, right?
Yeah, ABC News.
ABC News. And he would sleep on the job all the time.
All the time.
ABC, you didn't hear this. Anyway, he's long gone from that job, so there's nothing they could do about it now. But if I had to listen to the news all day long too, I would probably fall asleep, given the state of the news these days. But that's not what this video is about. It's not about fake news, real news, any news at all. But he developed a neck problem because he would sleep on the desk with his head down like this on a desk for hours. He worked the graveyard shift. And we worked so hard on his neck got much better.
Yeah.
And then, of course, this accident happens. But we're going to get him back to square one again. And he's not working that job anymore. So a lot of those problems went away after he quit that job, didn't they?
Oh, yeah, they really did.
Yeah.
Producers and editors, but...
So you would have to pull film, old film and old... Yeah, his neck doesn't feel great after this accident. I would say the neck is probably the worst of both of them. What would you say is more painful, though?
My
neck or your neck?
Yeah, currently my neck, but my lower back is definitely... It hurts.
Lay on your stomach. So we want to loosen some of the soft tissue up, especially when we're dealing with an accident. We're going to use this. It's more intense than a Theragun, trust me. All right, you're all set.
Thank you.
If you've been in a car accident and you live in the New York City metropolitan area, give us a call at the number below. Thanks for tuning in, and hope you feel better if you've been in an accident and you don't live in the New York City metro area. Go see your local chiropractor. Thanks. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.